Hi, we are at World Economic Forum 2024. I have a very special guest with me. His session has been one of the most trending and viral sessions across the world. I have with us none other than Mr. Shyam Bishen, who's head Center for Health and Healthcare, World Economic Forum. Sir, thank you so much for joining us at Times Network, and congratulations. Your session was very well received, and obviously it's one of the most talked about sessions here at World Economic Forum. What were the key highlights of your findings, or I would say session?
Yes. Thank you. First of all, thank you for having me on your program, and it's a pleasure to be with you, Meher. From the health and healthcare perspective, we are focused in few areas here at the Davos meeting this year. A couple of areas that I would like to highlight here are climate and health, looking at the impact of climate change on human health. That's a big focus area for us. The second one is pandemic preparedness, which is, how do we prepare for the next outbreak or next pandemic? And then the third one would be, how do we use AI in healthcare? The use of digital technologies in healthcare to solve for healthcare challenges. So these three are the key areas. In addition, we launched an Alliance for Women's Health, Global Alliance for Women's Health with Gates Foundation yesterday, which is to look at women's health situation, to see how we can increase investment and further innovation that is specific to women's health area. So these are some of the key areas that we are focused on here in Davos this week.
Right. I want to start with pandemic, not because it is sensational, but it is something which is still fresh in everybody's memory.
Yes.
And when a warning from WHO and many other places comes that the next pandemic, whenever it happens, and let's call it disease X,
yes,
could be 20 times more severe than COVID.
Yes.
It is scary.
Yes, it is scary, but the point here is not to scare people, not to do fear mongering. It's more about how do we prepare for the next pandemic. As you said, we had a session on disease X yesterday that was attended by the Director General of WHO, Dr. Tedros, by the Health Minister of Brazil, Ms. Nicia Trinidad Lima, as well as several CEOs. And that session was very popular, was trending on social media quite a bit. For right reasons, for the right reasons in the sense that everybody wants to know where are we with regard to the next pandemic preparedness. Disease X is nothing but a term coined by WHO a few years ago to talk about unknown pathogens, unknown viruses. So if there is an unknown pathogen, we don't know much about it. But then how do we prepare for that? How do we make sure that the health systems are there, they are stronger? We have a lot of learnings from COVID, what happened there, not just in low and middle income countries, not just in India and other countries, but also even in the US. My home country, US now, where we had that exposed several challenges in the health system there. So how do we prepare both the high-income countries as well as low and middle-income countries for the next pandemic? That was the topic of discussion there yesterday. Yeah.
Like you rightly said, it's a term which is coined for an unknown pathogen, disease X. But, I'm curious because in case of COVID-19, at least it was a known virus and a new variant of something which pre-existed. So not that we didn't have any knowledge at all.
Yes.
And still, like you rightly mentioned, it literally caused havoc across the world, be it developed countries or developing countries. For something which is unknown, how prepared are we, or how prepared is the world? Like you said, we have learned from COVID, but is it enough? And are people conscious enough, or is there complacency which has set in?
Yes, so that's what we want to avoid actually. We do see there is a complacency that's setting in, and we want to make sure that doesn't happen. We prepare well for the next pandemic. There are learnings from the last one, as I said. First of all, there are some good things there that came out, which was, in my mind, international collaboration, public-private partnership to come up with a vaccine in 10 months. This has never happened in the history of human beings, that we come up with a vaccine in 10 months. As you know, it takes 8 to 10 years to develop a vaccine.
That's true.
And that was because of the international public-private partnership. So we are very happy that we were able to get together at a global stage and bring various parties together, create incentives for the companies to come up with a vaccine quickly. So that was a great story from COVID-19. The challenge was on the equity side, on the access side. Not all parts of the world got that vaccine at the same time. I was in the US, we were taking our third dose or fourth dose, while people in Africa didn't have a single dose.
Right.
So we want to make sure that we prepare the world so that next time around there is a much more access to vaccines, and not just the vaccines, also diagnostics, therapeutics. Even therapeutics that came out of companies, pharmaceutical companies in the US, were not available in India for a long time,
right,
because of the intellectual property issues. How do we solve for that, going forward? So I see several things. One is we want to make sure that we work together to have a global disease surveillance system,
right,
where we are looking for pathogens, we are looking for new variants, and as soon as we have identified something new, we make the genomics data available to private sector, to public, so that public and private sector can do their job. They can prepare for it. Private sector, pharmaceutical companies, medical devices companies, diagnostic companies, they can come up with diagnostics, they can come up with vaccines and therapeutics. So early warning system, having a good disease surveillance system is extremely important. So that is the first part. The second part is that how do we prepare the health system? We saw that there was a shortage of healthcare workers. Primary care centers were not as functional in many parts of the world. Rural areas were not accessible. How do we make sure that we solve for those? And we have a few initiatives at the World Economic Forum in my center that we are working on. One is on the disease surveillance side, where we are working with the CDCs, Africa CDC, we're working with WHO, we are working with private sector, we're working with G20 to make sure that we have a good global surveillance system. We are also working with the same stakeholders on the vaccine manufacturing side, so that we create regional vaccine manufacturing facilities. Right now there's only 1% or less than 1% of vaccines for Africa are made in Africa.
Right.
That is not going to serve anyone. We want to make sure that there is a good vaccine manufacturing capacity in Africa that can operate during peacetime with children's vaccines, regular routine vaccines. But during pandemic times, we want to make sure that there is a capacity so that you can surge the production, for pandemic vaccines. So these are few things we are doing on the preparedness side for vaccines and surveillance. But then we are also looking at how do we make sure that there are enough healthcare workers. How do we solve for that shortage? And I mentioned earlier our work on the digital health side, on AI in healthcare. We believe that digital and AI can help in a big way to solve for some of the shortages, some of the challenges on the healthcare system. Right. So we are working with, again, with academia, with private sector, public sector, to strengthen the health systems around the world. We have done research in about 30 countries. This initiative is called Partnership for Health System Sustainability and Resilience, where we are working with London School of Economics, Philips, AstraZeneca, and others to look at where are we with regard to the current health system in any particular country, and then making recommendations to the government based on that what can government do to prepare for next crisis. And it doesn't have to be pandemic. Climate change in itself is a crisis.
Correct.
And that's changing the disease pattern. Many of the vector-borne diseases, respiratory diseases are going up because of climate change, because of global warming, because of air pollution and all. How do we make sure that our health systems are prepared to handle that?
Right. But sir, I have a question. You mentioned about sharing data, sharing information. Now, we did see during pandemic also, in the initial phase, unfortunately, not all countries were on the same page. countries like China were probably not sharing enough data. And I mean, there was a lot of hue and cry about the whole transparency issue between even superpowers like, let's say, US and China and so on and so forth.
Yeah.
So how do we ensure that there is enough transparency and information is available? Because a global crisis requires global cooperation.
Absolutely, absolutely. And these pathogens, viruses, they don't know borders.
Exactly.
They go across the world, across the border. We are living in a global world, which is, people are traveling all the time from one place to another, and they take the virus and pathogens with them. So it's a global issue, global challenge that we need to tackle at the global level. As you know, one of the themes for our annual meeting here in Davos this week is building trust.
Correct.
I think building trust is critical in this scenario as well. We want to make sure that we build trust among people, among governments, so that we again start to work together. That's
Right.
a big challenge. And during COVID, I think there was further erosion of trust. As you rightly said, people didn't share data, nations didn't share data, organizations didn't share data as much as they should have. So we want to make sure that we can avoid that next time around, so that we can have a faster response.
Right.
And that's what World Economic Forum, my center, is working on, working with various stakeholders from G20 to G7. I was part of the health ministers meeting in India for G20, and this was a topic of discussion, on pandemic preparedness side. We are working with G7 governments as well on the same side, that how do we make sure that we start to build a system where data and information is shared as quickly as possible, and not just to one person, one country, or one company, but make it public immediately so that public can prepare and private sector can do their job.
Right. I don't want to sound scary, but disease X.
Yes.
One is the name itself is scary, and
Yes.
when somebody says that it could be 20 times more deadlier
Yes.
than COVID, because till then everybody thought that COVID was the worst case scenario.
Yes.
Now you have possibility of some pathogen or virus which could be 20 times deadlier
Yes.
than COVID.
Yes.
So, how serious is this threat of disease X, whatever it could be?
Yes, I mean, with the way we live these days, with the climate change, with our encroachment of, forest and forest life, we are going closer and closer to unknown viruses and pathogens, and they are coming closer and closer to us. We are pretty sure that there will be outbreaks. How serious those outbreaks will be, we don't know. I think some people have done calculations. It could be same as COVID, or it could be as deadly as you said, 20 times. But that is the data that's coming from outside. That is not our research. We don't know where these predictions are coming from, but we for sure know that, based on what scientists are saying, based on what we are seeing, there will be outbreaks. And the whole idea for us is to see how we can contain these outbreaks from becoming full-blown pandemics. To answer your question, it could be deadlier than COVID. How deadlier it could be, we don't know. How fast it can spread, we don't know. But what we can do from our side is prepare for it. Is prepare for it in the sense the areas that we mentioned, in terms of the surveillance, in terms of the access to medicines, vaccines, and others.
Right. Yeah. India did play a crucial role in handling COVID, and the way they rolled out vaccine, everybody feared the worst case scenario for India considering the population that we have. And there were initial hiccups, but then the rollout of vaccine was, I think, one of the smoothest in the world.
Yes.
What role do you see, you see India playing going forward in any such health emergency?
Yes. No, so kudos to the government of India. I think definitely they did a great job in making sure that the vaccines were made accessible to large population. I think over 1 billion doses were delivered within a few months. So that's a great work there. But as you know, India is also pharmaceutical hub of the world, I would say, for generic pharmaceuticals. I think India supplies more than 60% of vaccines to the world. So I think India has a critical role to play here. not only to make sure that its own citizens, 1.3 billion people get vaccinated in case of a challenge or pandemic, but also, supply vaccines, to the rest of the world. India already did that to many countries, but I see that there is an opportunity for India here to take a leadership role at the global stage and become a supplier of the vaccines and medical countermeasures to the rest of the world. So I think India has a big role to play here, and India is poised to do that.
Right. You mentioned about technology and especially AI.
Yes.
Now, one is the equity in terms of access to healthcare and access to the best available medicines or remedies.
Yes.
The other part of it is equity in terms of having access to the best available technology. And there, unfortunately, so far there is dominance of very advanced economies like, let's say, US or China and even Europe to some extent, who are controlling, I won't say controlling, but who are at the forefront of the AI revolution that's happening across the world. Yes. How do we bridge that gap between developing economies and the developed economies?
As far as India is concerned, I think India is in a good place when it comes to digital technologies. As you know, in India, the IT system, the digital systems are much more developed than any other developing economy. So I think India is very well poised to do that, to take again a leadership role there. We have established a Center for Fourth Industrial Revolution, a C4IR, in Hyderabad, which will tackle this. They will focus together, working with us, we will focus on how to bring AI and digital technologies, working with our centers in other parts of the world, whether it's US or Europe or any other part of the world. How do we work together to bring these technologies in? I mentioned India has a very strong position here and could take a leadership role again, because on both sides, on the digital side, India, I believe, is quite advanced. To build these technologies, we need data. You need health data. And India has good amount of health data. We just have to make sure that it's trustworthy and accessible health data. So India can take that leadership role on both sides, bringing the health and the digital together, and then working with organizations like WHO, like ourselves, like G20 and G7. So I think that is already happening in 2023 when India was leading G20, together with health ministers with WHO in August of last year. In Gandhinagar, actually, we launched a global initiative on digital health, and India took charge of that. So I think there is a huge opportunity here for India to work with other nations, bring that technology in-house, meaning to the country, as well as develop it further for the rest of the world.
Right. One last question to you, sir. Like you said, there is going to be an outbreak, and obviously you can't you can't predict the timeline, you can't predict the scale, you can't predict the severity.
Yes.
But with the amount of fear mongering that's happening across the world, I won't say post your session, but
yes.
There is a lot of discussion about it.
Yes.
What would you like to clarify in terms of the difference between being conscious, being aware,
yes.
and being scared?
Yes. I think there is a problem of misinformation and disinformation here, where public needs to be educated. Right information needs to be put in front of public, that look, this is not about fear mongering, this is not about scaring people, it's about having public health system prepared. It's about making sure that we have better systems in place so that we can avoid unnecessary deaths, unnecessary sickness to people. So I think to answer your question, it's more about misinformation and about education. As we saw, even in the last pandemic, there was so much vaccine hesitancy, so much misinformation about vaccines in certain countries, in certain parts of the world, in certain locations. And it was just the challenge of educating public. So public health education, public education on the health side is critical here, and the governments need to handle that. Working with again international organizations, it's important that we put the right information in front of the public, because there will always be people who may want to create misinformation and put it in front of the social media and others. So we want to avoid that.
Right. Well, sir, thank you so much for joining us, and let's hope that we never face a situation where we face even deadlier crisis than what we did
Yes.
During COVID. But at the same time, let's hope that we are better prepared, and I wish you all the luck for the same. Thank you so much, sir.
Thank you so much, and I hope so too. Thank you. Thanks for having me on your program.
Thank you, sir.
Thank you.